Hey everyone, welcome to the latest installment of Phoenix Children's Facebook Live. Today we will be talking about spinal muscular atrophy. I'm Peter Ballestre, brand manager here at Phoenix Children's, and I have with me Dr. Saundra Burns, pediatric neurologist at Barrow Neurological Institute at Phoenix Children's. Thanks for being with us today. I appreciate it.
My pleasure.
Yeah. So August is Spinal Muscular Atrophy Awareness Month. So we want to talk about it, educate people about it, and what we're doing here at Phoenix Children's, specifically at Barrow Neurological Institute at Phoenix Children's as well. So the first question, before we get into that, actually one real quick thing. If you have questions, feel free to write them in the comments. We'll try to get them to you live. If we can't, we'll answer them afterwards. We'll have this broadcast posted out there for quite a while, so feel free to ask questions down the way as well. But let's get into the first question and the most basic of all questions. What is spinal muscular atrophy, or SMA?
So spinal muscular atrophy is a progressive neurological condition that really manifests itself by progressive weakness. And they use the word spinal muscular atrophy because even though it's a muscle progressive weakness disorder, it's the spinal motor neurons, or the cells in the spinal cord, that are actually stopped working that cause the symptoms.
So the muscles begin to weaken and it can be fatal or no?
Yeah, so it's a progressive disease and it comes in a few different forms. But the severe form that usually happens in little infants is progressive, and usually without treatment is degenerative and eventually fatal.
So get into a little bit of what actually causes SMA. What do we know at this point what the causes might be?
Okay. So this is a genetic disorder. It means that it runs in families, and it means there's a gene that's abnormal. It's actually the second most common fatal neurological disorder after cystic fibrosis. So it's a fairly common disorder.
Okay. How does SMA present, or what are the primary symptoms that a pediatrician or a parent may see that might tip them off that this might be happening?
So the most common symptom, regardless of what age that you present, is one of progressive weakness and usually losing skills, losing motor skills. All of these children are usually very bright, very alert, and there's nothing wrong with their brain. They're quite smart, but they usually present with progressive weakness after being normal for a period of time.
Okay. So how common or uncommon is spinal muscular atrophy?
So as I said, this is the second most common genetic fatal neurological disorder. And in our practice, it actually becomes quite common. But generally we tell people, like every probably 1 in 6,000 live births, babies will be affected.
Okay. So at this point, is there a cure for spinal muscular atrophy?
So one of the reasons we're here today is because there is a new treatment. It is unclear if this treatment is curative because the time of treatment probably determines your outcome. So optimally, we're treating kids after they've developed symptoms, and it is unclear how good you will do if you treat children before they develop symptoms. So the answer to the cure question is still unknown.
Unknown. Okay. So let's go back a little bit. Spinal muscular atrophy in children. What ages does it typically show up, and how does that affect the care timeline, if you will?
Okay. So traditionally, spinal muscular atrophy has been classified into 3 or 4 different types, depending on when you actually present with symptoms. So type 1, which is probably 30 to 40% of our patients here, usually present before 6 months of age, and those children never sit by themselves.
So they always are laying back, and they cannot sit up at all.
That's right. If they ever acquire the ability to sit up, they have a somewhat milder form of the disorder, and that gets classified as type 2 spinal muscular atrophy.
Okay. So they progress. The types progress as they get lesser and lesser as the types progress.
Or they present later and usually have a less severe or less progressive disorder, but still progressive.
Okay.
This disorder almost never stays static.
So you referred to it before, and you mentioned it. There's a buzz in the spinal muscular atrophy community at this point around this new therapy called Spinraza. Let's talk a little bit about that. What is it, and what are we doing with Spinraza here at Barrow Neurological Institute at Phoenix Children's?
So, Peter, you asked a very long question. So let's talk about the treatment itself.
Okay.
The treatment itself is a medication that's based on the fact that you can make a gene that's not the gene that's missing in this disorder, but a gene that's on the other side of the same chromosome. They can make the protein that is normally not made.
Okay.
So by giving this genetic piece of DNA, you can actually make the protein that is deficient.
Okay.
And modify the disorder. Okay.
So that's being offered throughout the country at select hospitals. Talk about what we're doing here at
That's correct.
Barrow.
So this medication became available through FDA approval on Christmas Day of 2016.
Wow.
Okay. So relatively new therapy. It was approved quite quickly based on a study that was performed in type 1 spinal muscular atrophy, or the infants who were symptomatic before 6 months, who never acquired the ability to sit. Okay. So upon FDA approval, there was a big buzz in the community about getting patients treated.
Mm-hmm.
There was somewhat of delay in the providers from the insurance companies of actually authorization of the medications or policies of who is going to get treated and how until like probably April. But again, commercial treatment of patients who are not on studies actually began here at Phoenix Children's Hospital in the first week of March. Okay. So we have had patients on treatment since March of 2017.
So that's kind of the segue into, and I know we're still waiting and awaiting to see kind of how this looks, but what's the outlook maybe for kids that are that have SMA without the drug and maybe with the drug? What are we hoping for? Are we hoping just to halt it, or kind of what's the outlook for this?
So I think that some of this is not clear. Some of it depends on how long you've had your symptoms before you get treated, which will be a theme that we'll come back to, because obviously early treatment makes a difference. But all of the children basically who have type 1 who are treated early, okay, clearly get some improvement from this medication. So they gain motor skills that they would clearly not have if they were untreated.
Wow.
So we have type 1 patients here who are sitting by themselves, who have good head control, who are talking, babbling. None of those skills were acquired in untreated patients.
Your thoughts on you've been working in the spinal muscular atrophy realm for quite a while. Is this pretty amazing to you?
This is a game changer. I think it's the most dramatic improvement in a neurological disease that I've seen in my career.
Mm-hmm. So it's pretty exciting.
It's very exciting and very rewarding.
So can you explain the kind of the care continuum that a patient with SMA would go through if they were to come here and receive that kind of a treatment? Because there's a lot of handoffs, and there's so many great subspecialties that we have here. Can you kind of walk through maybe what that would look like?
Yeah, I think this is probably, I say this has been a game changer and an eye-opening in my career. I don't think I've ever been involved in a situation where as many people, either medically, subspecialists, or authorization people, administrators, pharmacists, interventionalists, radiologists who are giving us medicines that I'll talk about. It's been really a hospital policy and plan since it became authorized to get this medication to the appropriate children as quickly as possible. It has been very complex, okay, and the details are even more complex, okay.
Yeah. How is the drug administered typically?
So the drug, unlike most drugs, it's not given by mouth, and it's not even given in an IV. It's given through a spinal tap, or given in the spinal space. And in Phoenix Children's, it's given by a group of subspecialty doctors called interventionalists or radiologists. So our IR, interventional radiologists here at Phoenix Children's Hospital, have a service that's basically given now about 50 or 60 doses quite safely, and thus far without any type of problems. So again, it takes a very subspecialty group of physicians to be able to administer this and to administer it safely.
When we talked about doing this Facebook Live, one of the things we talked about was the need for referring providers, for pediatricians, for primary care physicians, to at least have this as a thought if their patients are presenting with any kinds of these kinds of symptoms, the red flags. Talk a little bit more about why it's so important for these doctors throughout the state and beyond to start understanding what this means.
So traditionally, spinal muscular atrophy was a disease that was only treated by support therapy. Okay, so we maintained good nutrition, good respiratory status, but we had no medicine that really changed the outcome. Okay, it's been quite clear now through the initial studies that were done on patients who were symptomatic that they clearly improve, okay, and gain skills they wouldn't have gained. There have also been some studies that are not published yet that have treated a group of infants who are pre-symptomatic or before therapy. And those children, some of them have approached normality and are actually walking.
Wow.
Okay.
Yeah.
So type 1 patients who are now ambulatory or walking is something that is just unheard of.
So historically, how long have we known about spinal muscular atrophy? It was known as something else prior to this, wasn't it?
Yeah. So the severe form was described in the 1800s by Wernicke-Hoffmann. So it used to be called Wernicke-Hoffmann disease or Wernicke-Hoffmann disorder. There are various forms that have other physicians named to it, but some of the pediatricians out there, I think, clearly would call this Wernicke-Hoffmann disorder, rather than spinal muscular atrophy type 1.
Prior to, not long ago with Spinraza, the new therapy, what were some of the therapies that were used prior to this for treating SMA?
Well, there have been lots of medication trials, none of which have been really helpful. But in general, with good nutritional care, good respiratory care, you could prolong the patient's motor function and survival a lot.
Okay.
So we have a lot of older patients who have been treated over the years who were not in the initial studies for this medication.
Okay. With the time of the essence with this, why do we know why getting to this earlier helps?
Yeah, I think it's pretty I think evident that the disorder is actually caused by a lack of a protein that's being made, and the degeneration of these cells in the spinal cord can either be stopped or it doesn't happen if this protein is replaced. So this treatment is clearly time sensitive. The earlier it is given, it's clear the better that the outcomes are. So before, it didn't make any difference whether you made a diagnosis at 4 months or 6 months. Now it makes a difference, and we'd like to treat most children now even before they have symptoms if they can be identified.
See, therein lies the issue, right? Is that it is hard to identify it early on because the symptoms can be, there might not be as many symptoms, or they can be similar to other things that might be out there. Like what makes it so hard to identify this at such a young age?
I think because it starts very subtle, and the weakness is not significant.
Yeah.
And usually by the time that there was referral made or the patients are seen, the weakness is significant enough that we can actually make a clinical diagnosis even before we may have a genetic confirmation.
Okay.
So
Yeah.
it is clearly a time-sensitive disorder now.
Okay. So what are the outlooks for life if for someone that may have SMA maybe before and now going forward with the new regimen? Is it 30 years old, 50 years old, or what kind of is outlooks for some of the patients?
So the answer to that question is that we really don't know. Some of the initial patients who are on the clinical trials are now probably 2.5, 3 years out.
Wow.
With various type of outcomes, but almost everybody who's continued therapy is either stabilized or gotten significantly better.
And what is the outlook in terms of the volume of patients that we may see here at Barrow Neurological Institute of Phoenix Children's? Are we going to see an increase? Is this something that is a game changer in terms of getting coverage to or getting that care to more kids?
Well, we based on the actual statistics of the disorder, being about 1 in every 6,000 births, we believe there's probably 15 new cases in Arizona per year.
Wow.
Okay, so 15, not a lot, but again, 15 children who could possibly have a relatively normal lifespan if they're treated early.
Yeah. Okay. When a child has SMA, what are the parents having to do? What does it entail for someone out there that might not understand what the parents have to go through? How much effort is it to work with a child that has SMA? Are they in a wheelchair, or what's the parents' role in this kind of situation?
Well, again, like any chronic disorder in pediatrics, the parents are the caretakers. They're sort of the primary. I call them the primary doctors. Really comes down to it. The care is overwhelming. I mean, the requirements for an untreated patient with this disorder is virtually daily care, daily feeding care, daily respiratory care. Again, fulfilling the child's need on a 24-hour basis.
Yeah.
It's overwhelming.
Yeah. And I want to come back to, again, if you can expound a little bit on also this being a game changer, this therapy. You mentioned that you don't often see this kind of a breakthrough, if you will, in a care associated with something like this. Is this just going to grow and become bigger and bigger in terms of kind of expanding the cure for or the care for SMA?
Well, yes. I mean, so this type of treatment, which is replacing the actual protein through a genetic manipulation, is actually being expanded, and clinical trials going on right now of giving the gene itself to these patients to make the protein. There's other treatments that also are working in different mechanisms that also may change the natural history. So it's a time where I think that the science is basically caught up with the disorders, where there's treatments that are rapidly becoming available they're changing the natural history of the disorder.
Yeah.
So my knowledge of what I thought SMA was 5 years ago, 10 years ago, what's going to happen, is out the door right now.
That's pretty amazing, right?
It's quite rewarding to see this happen.
You talked about it being a genetic disease. It also has no choice between male or female. It kind of is. It goes across the board, right?
Correct. So it's a recessive disorder, which means that you need 2 recessive genes or abnormal genes, one from each parent, in 95% of the cases to get the disorder. So all people who have this form of spinal muscular atrophy that's responsive to this therapy have 2 abnormal genes on a chromosome that can be easily tested now with a short week, 10-day turnaround time.
That's what I was going to actually ask is, so if you were a referring physician, a pediatrician, a primary care physician, and you had an inkling of something, how involved are the tests, and what would be the way that they would say to the parents, I want to test for this?
Yeah, so I think that in that type of situation, right now, I would ask the pediatricians to contact our service here. We have an excellent coordinator who's put together this whole program, and her name is on the site, the Facebook site, the Phoenix Children's Hospital site. We can direct them to the actual diagnostic test and how it's done to give us a certain amount of information that we can go ahead and treat children.
Yeah.
So I think it's a little bit difficult for most pediatricians to start ordering this test without really knowing the implications or what exactly we need in order to present to go forward with treatment.
So always talk to the doctor.
So we've gotten calls already of patients, of pediatricians or patients with concerns, and those patients can be seen fairly quickly.
Okay. Yeah. So yeah, I was going to say, is there a wait? Would they be able to get in right away to
Yeah. So if we get a call from a doctor with a patient who has the right type of clinical exam, right age, those patients are seen quite quickly.
Okay. So kind of to wrap up, some high points. So time is of the essence. The new therapy, breaking ground. Anything else that you wanted to add in to maybe providers or physicians or something along those lines that would get the word out more? I didn't even know that August was Spinal Muscular Atrophy Awareness Month. There is a chapter for Cure SMA, an Arizona chapter that we work with as well. Anything else that you wanted to add in about it?
No, there's a very strong parent group here. I mean, there's a Families of SMA group, a Cure SMA group, and the Muscular Dystrophy Association. All of these people have really helped us establish a program here and enabled us to basically see virtually all the patients in this area.
Yeah.
We have actually, attempted to meet with the families right after authorization from the FDA, and have been able to provide treatment now, or we're providing treatment to virtually all patients who are affected.
Yeah. Okay. Let's finish off with we talked about the treatment, but what is kind of the timeline? And I know it's probably different for everyone, but a general timeline of this regimen. Kind of what would be the timeline for someone that had the approval for Spinraza for this type of a treatment?
So getting the actual medication here for a patient really has been somewhat problematic and changing, but I would say that it's getting easier.
That's good.
It's getting easier because the providers, the authorizations, insurance companies have all sort of realized that that there is a time component to this.
Mm-hmm.
So for the babies who are presenting early, we've been able to get them on therapy very, very quickly. Okay?
Yeah.
This isn't the type of medication you just get from the pharmacy. This is a medicine that is shipped on a basis of the same day or a few days before it's given. It's quite expensive, and it needs to be given accurately and safely.
So, is it? I think when we had talked, there was kind of the booster or the boosts or the maintenance kind of. Can you give a kind of a general timeline how that works?
Yeah. So the treatment actually is based on how long this medicine actually lasts in your spinal fluid once it's given.
Oh.
So we call that a half-life. So it needs to be dosed up for the first month and a half.
Mm-hmm.
So there's 3 doses in the first. There's a dose at day 0, 2 weeks later, then 2 weeks after that, and then a month after that. And then it's given every 4 months.
Okay.
And this is all through a spinal tap, all done in children who could be quite ill or sick. Again, I just emphasize that it takes a very special group of doctors that give this medication, and it's taken a whole group of individuals to evaluate the children, provide a lot of the providers with the information that they require us to have before we will be able to treat somebody.
Yeah.
So I was spending last night looking at the amount of people who are involved in this. It's probably 30, 40, 50 people. Again, all started right after authorization through a hospital program that's really supported us.
Yeah. You sound proud of the team that we have.
Yeah,
here.
no, I mean, this has been just one of the happiest parts of my career is just to see this happen and see some of these pictures that the parents are sending us of their kids sitting in parks, kids talking to us. it's just something that's quite novel and very rewarding.
Well, I'm excited to see, in talking with you, I'm excited because you've exuded a lot of excitement about it and hope. And in working with some of the families that I've met already, I think it's pretty amazing that at Barrow Neurological Institute here at Phoenix Children's we're doing this here, and it's groundbreaking, and it's also very rewarding, I'm sure, for you as well. So I wanted to thank you for the time that you spent here today. Again, we probably want people to talk to us, referring physicians to talk to us if they've suspected in their patient. But again, if you want to watch this, we'll have this on our profile for a while. You can ask questions, and we'll get back to you as soon as we can. Thank you again, Dr. Burns, for being with us today.
My pleasure.
Yeah, thank you so much, and we'll talk to you soon. See you for the next installment of Phoenix Children's Live.